Yes, ARIEL-3 is a trial that has investigated the role of a new PARP inhibitors, Rucaparib, in a setting that is the setting of platinum-sensitive ovarian cancer patients that have responded to platinum. This is a setting where there have been other PARP inhibitors like Olaparib and Niraparib that have been already approved. And in this study, there were the inclusion of patients with BRCA mutation, both at the germline and somatic level, and also patients without BRCA mutation that in any case were assessed by a test evaluating the grade or the degree of their homologous recombination deficiency. This test is called loss of heterozygosis and is able to identify two categories between the non-mutated patients, those with HRD positive test and those patients with HRD negative. So the results were very encouraging because there was an increase in progression-free survival, particularly strong as expected in the BRCA mutated patients, but this advantage was present for the patients treated with Rucaparib, also in patients with HRD positive tumors, but also in the cases with the HRD negative. This study indicates that Rucaparib is a new option as maintenance therapy. It is very well tolerated and represents a new option for this setting of therapy in ovarian cancer. I think the data of Rucaparib in terms of efficacy are very similar to those obtained with Olaparib that has been tested only in BRCA mutated, and Niraparib that has been evaluated also in patients without BRCA mutation. So I feel that these three drugs perform in the same way. There are some differences in the safety profile in the sense that all the three drugs are well tolerated, but some toxicity are different. For example, Niraparib has more hematological toxicity and Rucaparib more liver toxicity. But overall, the majority of patients is able to tolerate the treatment and stay on treatment even for very long period of time. So overall, I think it's important to have a third option because when you have more options, you can better tailor the therapy to your patient. And for sure, the addition of PARP inhibitors in this setting is changing the life of these patients because there are many patients that are long responders and do not progress and stay on therapy for months or for years.